Hello, everyone, and welcome to another episode of Aging in Action. And we're super excited to be talking about the virtual emergency department. And we have a very special guest with us today. We'd like to welcome Renee-Anne Montpellier, who is the emergency physician at Health Sciences North and physician lead for the virtual emergency department. Welcome, Renee.
Thank you. Thank you for having me today.
Thank you so much for coming on to talk about this new program that we're very excited to kind of discuss with the community in case they don't know about it, to access it as a service. But before we kind of dive into that, can you maybe just introduce yourself a little bit and how you got involved?
Yeah, so as you mentioned, I'm one of the emergency physicians here at Health Sciences North. I'm originally from Sudbury. I did all my studies here, so pretty happy to be able to serve the community of Greater Sudbury. And so I got involved in this project. So when the pandemic hit, I'm not sure if you guys know this, but our numbers in the emergency departments dropped drastically. More than 50% of patients were coming in. And so that created a lot of anxiety for us. It was, you know, the calm before the storm, but the storm was never coming in. It was just very calm. And we started realizing, you know, we need to be able to get access to these patients that aren't coming in. And we started doing all our meetings virtually on Zoom, kind of like this. And so we thought to ourselves, maybe we need to access these patients virtually. At the same time, the Ministry of Health came out with this program to fund potential virtual services. And so we really decided to jump on board. I decided that I wanted to lead the project because I think innovation is super important. I was raised with technology and I felt like it was something I was very comfortable with. And so that's how I became the physician lead. And that's when we started getting things rolling in the fall of 2020. And then things launched on December 15th, 2020.
Wow. Sounds like a perfect fit for you.
Yeah.
That's awesome.
What do you think was the reason people weren't? It was because they had a fear of catching COVID and that's why they didn't come into the emerge?
Yeah, it was exactly that. So people, I mean, it feels like almost like a lifetime ago, but
sure does.
People were very anxious at first. And so they felt like they were going to potentially catch COVID. I think they also felt like they shouldn't be bothering the healthcare system, especially at first. If we're not super sick, maybe we shouldn't be coming in. But when times kind of, you know, months, probably 3 to 4 months into the pandemic, that's when people came in and they were really sick. So they weren't actually seeking medical attention. And by the time they got to us, it was almost too late for some people. And so that was, again, super nerve-wracking. And that pushed us to really start working on this project.
Great.
I think that's really needed in the North.
Yeah.
I mean, I understand that concept, right? If you're not really sick, why would you go there and risk getting COVID, right? So people probably waited longer than they should have to go get checked.
Yeah, for sure. Yeah.
So can you talk a little bit about how the process works to participate?
Yeah, absolutely. So it's actually quite easy, which is what we were aiming for, because I know a lot of people aren't comfortable with technology. I think they're getting more comfortable now because it seems like it's kind of here to stay. But what they do, we're open from Monday to Friday, 10 to 6, but we start appointments requests at 7:30 in the morning. So all they have to do is log on to www.hsnsudbury.com/virtual-ED. And that'll bring you right to our webpage. And there's a small button there that says book appointment. And once you hit that, there's a small questionnaire, basically the same type of information if you were online shopping that you need to put in there, minus a credit card. So your name, your address, an email, your phone number, and I think maybe your family doctor and your health card. And then you hit submit and we call you literally within 30 to 60 minutes.
Wow.
And you usually see the doctor within an hour or two. So it's quite fast. You speak to a clerk initially, transfer to the nurse to do a triage. If she feels you're too sick, you're told to come in. And if she thinks, this is appropriate, then we book that appointment with the physician. And like I said, it's usually done within an hour or two.
So that's really fast.
It's very fast.
Excellent. Like how many?
Is there an age?
Sorry, Lisette, go ahead.
Well, I was just wondering, is there an age requirement? Like, is it just for seniors or is it for everybody?
It's for all ages above 12 months. So it's hard to assess a baby virtually. So we like to see those in person. But no, there's no age limit. Like we're seeing, I think our oldest patient so far was 95. They have their family members at home with them. So it's ideal. Often it's either a friend or a child that's logging in for them. And then we're able to see them. So no age limit whatsoever.
Like how many people would be using that system in a week, say?
So I would say it's about 20 per day. So, I mean, that's about 100 people a week. Yeah, and we have capabilities to see 30 per day. So they're 15-minute appointments, which 15 minutes sounds short, but honestly, in the Emerge, you're seeing your physician for like 5 minutes. So 15 minutes is really long, and we get to really kind of zone in on the patient and see what's going on.
Wow.
So when it comes to doing virtual visits, I'm trying to picture it a little bit. Is there any difference? So when you see a patient in the hospital, you see them in the hospital atmosphere. When you're seeing a patient virtually, you're seeing them at their home. Have you guys noticed any advantages or disadvantages to taking these visits virtual?
I would say mostly advantages, especially in the elderly population. I find when people come into the Emerge, they really look almost at their worst. Like they're very vulnerable. They're just laying there in a stretcher. They're not walking around. You really don't know how well they're doing from a capability standpoint or the ADLs at home. Whereas when you're seeing them virtually, you're seeing if they're sitting in a lazy boy, if they're kind of walking around with their walker, you're seeing if they're laying in bed and really don't look well. And so it's really nice to be able to see what people are like at home. And if they have their family member there, it's nice to kind of get their input as well. There was a time where we weren't allowing visitors in the Emerge. And so this was a great opportunity to have their family members with them. And so I would say this is a huge advantage, because if they're not doing well and they're laying in bed, then that's a sign to call 911 versus if they're sitting up in the lazy boy telling me they're a little bit short of breath, reassuring, right? And so it's been great.
Well, and maybe they were like my mother was, what do they call it? White coat syndrome. Like she was more stressed out meeting with a doctor, whether in the office or in emergency, which didn't happen too often, but a lot of people have a lot of anxiety just going into Emerge.
Absolutely.
Yeah. Oh, that's great. I think
that or talking to a doctor without a family member. I mean, I know my own mother will come home from her appointment and I'll say, well, what did the doctor say? And she, I don't remember, because the stress, right? The stress of the moment. So it's always important to have support there with you, right?
Absolutely.
Yeah. I'm thinking of some people too that, will just refuse to go see their doctor or go to Emerge, even though they need to, because they're physically getting out and going there. And they're scared versus sitting at the comfort of son or daughter to help them through the technology. Because you touched on this earlier. You said technology is kind of a barrier for us. And with COVID and everything that's happened, it's forced us, especially me, to learn more about technology and try to get more comfortable with technology. So family members being there can help book those appointments for their loved ones.
Absolutely.
Through the virtual platform, which is really, really beneficial. That's awesome. Okay.
Probably the first time they try to do it, it's stressful for all of us, right? To try something new, but I think there's a huge advantage in doing that, and certainly being able to talk to somebody, have more time to spend with somebody is better always.
And also our nurse has been trained to actually walk people through. So when she calls them, she'll actually stay on the phone, make sure the app is downloaded, that they're connected and waiting in the virtual waiting room before she hangs up. So she really spends the time with patients, making sure that their technology is working, which is nice as well.
Yeah.
Yeah. No, technology sometimes likes to test our patience, right?
Right. We never have any problems.
Yeah, we never had a problem.
Yeah.
So what if you, and I hope this isn't a silly question, but I'm going to ask it. What if you need a prescription, or you need x-rays, or you need some kind of additional, follow through after the virtual appointment? I mean, how does that work?
Yeah, so we tell people that meeting us virtually is essentially the same as meeting us in person. And so if the patient needs same day blood work, we're able to do that. Of course, they need to come in, but they're not coming in through the emergency department. If they need same day x-rays or ultrasounds, we're able to do that as well. We are faxing prescriptions to their pharmacy, so they're able to pick that up. If we think they need to see a specialist, so a dermatologist, an ophthalmologist, we're able to refer them for that. If we think they need home care services, CCAC, Bayshore, we are able to do that as well. So essentially, we're able to do everything virtually that we would be able to do in person, unless we think the patient is too sick. And then we recommend that they come in. And again, we have a bit of a fast track system. So if we've seen them virtually, then we're able to kind of squeeze them in a little bit more quickly and hand them over to a colleague.
So how many doctors in ER would be, is there like one or two dedicated to just doing that, or how do you
so it's one doctor per day. All of us are capable of doing shifts, and everyone's tried it out. So it just depends on the day. We treat it like we would be picking up a shift in the emergency department. We pick up a virtual shift.
And I think you mentioned you have room for 30 slots, and you do on average about 20 a day. So there's still an opportunity for more people to be able to access this service. So is there any additional resources, anything we can do to share this program? I know you mentioned a website to book online, and we're going to be sure to add that information to our video so our viewers who are watching can click on it and access it. But is there any additional resources that we can guide people to help educate them on this program?
So I think word of mouth is huge. So if people can share with their family and friends that this service is out there, if they're able to follow the HSN Facebook page or Instagram page, they're constantly advertising the service and how to access the service. So I think that's probably your best bet. And if you're not feeling well and you're wondering, is this virtual appropriate or not, just fill out a request. We'll let you know if you should come in person. So I would say try the virtual clinic. If you're not feeling like you have a life-threatening, condition, give us a try and we'll see if we can help you. But spread the word, friends, family, as many people as you can through social media.
And I think it's important for them to know that it's free, right?
Absolutely.
Yeah.
People always wonder, how much does this cost, right? So free is good especially for our aging population.
Yeah, it's free, and it's also available in French or English. And so if someone purely speaks French, we are able to accommodate that.
That's awesome. I think that's really important to a lot of our viewers to be able to know that it's bilingual, for sure. No, this has definitely been very educational when it comes to this program within the community. And I am keeping an eye on time, and we still have a little bit of time left. So, is there anything we haven't covered? Is there any final thoughts that you would like to share with our viewers?
I think the one thing I want to share is the success of the program. And so once patients get an appointment, they get a small survey, and the satisfaction survey has been 95% of people have been satisfied. And I think that's kind of unheard of when you hear about healthcare and services out there. Right. And so we've been getting comments like, best service ever. This service is perfect for keeping emergencies for the emergency room. And so I think people need to, open their mind and really try this new service, and we'll be happy to help you and guide you in the right direction. So again, just share with as many people as you can, and that would be super appreciated.
No, we're definitely going to share. Yeah. And you mentioned some social media links. Gwen's a pro on social media, so we'll make sure we include those too, so people do know to follow and see what updates HSN has to offer when it comes to our community. And I think this was a program that was a long time coming. And COVID kind of impacted it and pushed it out to the community even more. And it's great to see that you have a 95 percent success rate and that people are using it and enjoying using it. And that's going to help us with word of mouth as well in getting this much needed program. And kind of who knows where it's going to go in 6 months from now. Maybe we'll have you back on and you'll talk about some other great program that has gone virtual within HSN, as we're always learning and growing together. And, you're helping our community age in action. And we want to thank you so much for joining us on this show. We'll definitely share your link, the website, so people can register. And we want to thank you for your time and helping educate our community.
Thank you so much for having me.
Service. Thanks so much.
Thank you, Renee.